A very warm welcome to one and all who are joining us for this enlightening discussion. I, Dr. Geeta Deswal, and alongside me is my esteemed co-moderator, Dr. Ankur Agarwal. Together, we are thrilled to host this insightful samvad, a dialogue that promises to unravel the mysteries and intricacies of selecting the right specialization for masters in pharmacy. The journey of pharmacy students is an exciting one, full of opportunities and pathways that lead to a plethora of specialization. With us today, we are honored to have a distinguished panel of experts who are guiding lights in the world of pharmacy education. Allow me to introduce them. First of all, we have with us Dr. G.D. Gupta, Director of ISF College of Pharmacy, Moga, Dr. Vijay Bhalla, Principal, SGT University, Gurgaon, Dr. Alok Mukherjee, Principal, United Institute of Pharmacy, Allahabad, Dr. L. Satyanarayanan, Vice Principal of Bharati Vidyapeeth, deemed to be University, Pune College of Pharmacy, Pune. Today, we are gathered here not only to learn from these eminent personalities, but also to engage in a meaningful conversation that will aid aspiring pharmacy professionals in making one of the most pivotal decisions of their academic journey, choosing the right specialization for their M pharmacy. During our samvad, we will delve into a variety of aspects that play a role in specialization selection process. We will explore the factors that influence this decision, the emerging trends in the pharmaceutical industry, the prospects and challenges of different specializations, and much more. Our esteemed panelists will share their insights, experiences, and wisdom, helping you gain a comprehensive understanding of various specialization options available. By the end of this samvad, we aim to equip you with the knowledge and clarity needed to embark on your journey towards an informed specialization decision. Once again, I extend a heartfelt welcome to each and every one of you. Let us embark on this enlightening journey together as we unravel the secrets of choosing the perfect specialization for a rewarding and successful career in pharmacy. So stay tuned, stay engaged, and let's the samvad begin. So for this, I want to ask first of all a question to Dr. Vijay Bhalla, sir. Sir, may I? Sir,
Am I
what is the?
audible, Dr. Geeta?
Yes, yes, sir. You are
Am I
audible.
audible? Uh, Please.
I think there is some internet problem.
Yes. Hello.
Yes, sir.
Do.
Uh, Sir, my question to you is, what is the procedure to take admission in post graduation in pharmacy in India with GPET qualification qualified
Oh,
student or without GPET?
okay. Very good evening.
I think there is some internet problem with the Vijay Bhalla, sir. So let's proceed with our next question.
Yes, ma'am. Start, ma'am?
Yes, sir. Yes, sir.
Yes, okay. Good evening to all. Myself, Mr. Ankur Agrawal, Moderator, Team Pharma Lok, and Associate Professor, Jai Institute of Pharmaceutical Sciences and Research, Gwalior. My question is Dr. G.D. Gupta sir से है. Hello, audible, Dr. G.D. Gupta sir? Sir off है sir.
1 minute,
Okay.
1 minute, but
जी
just
sir.
I am reaching at home within 1 minute. Yeah.
Okay sir.
So you can take, yes, please.
Okay sir.
In the meantime, you can just go through the other question also. You have a continuation with the other same question to other
Yes. Yeah. I'm coming to you, sir.
speaker.
Okay ma'am. Yeah. Question 3 sir, ma'am. Please.
So my
Dr.
next
Bhalla
question.
has joined now.
Alok Mukherjee, sir, my next question to you. How many types of scholarships are available in India in higher education? Please clear the current status of GPAT scholarship also.
Good evening to everyone, especially Dr. Bhalla sir and
Yes.
other moderated committee and other expert also, Dr. G.D. Gupta and Dr. Lakshmana sir. Basically, we all are a pharmacist. We know that GPAD is a basic requirement for doing a M.Pharm throughout the India, and lot of confusion has been raised since last 1 year or 2 year when the AICT has withdrawn his approval to different colleges, and that's why the people are just this year 2023 who has qualified GPAD from this as per the part of this AICT, but still there is a confusion. But we have gone through a lot of website and also discussed with the different expert of the Pharmacy Council of India that definitely those who have qualified GPAD, they will get the scholarship either from directly from NTA or from AICT or some different colleges like NIPER or different other college will provide their own scholarship. But definitely PCI will also go through on this process, and very nearly the PCI will announce that they will also give the scholarship as AICT has earlier given. But still the draft has not been come out. That's why the confusion is still there. And GPET qualified pupils can perform their M.Pharm with scholarship. Like in NIPER has announced that they will give their own scholarship. Some of the college like BHU, IITs, and other established colleges has their own scholarship program. Some defined universities like private universities also has scholarship with their own institute, but still there are some private colleges or some universities of government, they are still undertaking a part of what type of scholarship they will give. So अभी थोड़ा सा confusion है, but within this August last week we'll get a very clear picture of GPAT also. Apart from GPAT, there
Thank you.
are some other apart from GPAT there are some other scholarship like NET, JRF, then Student Jayanti Fellowship Scholarship for all the people like from DST, and one Sitaram Jindal scholarship was also there. Those are given this 3,30,000 scholarship for all the students especially. Then Narottam Sekharia scholarship is also there. This is from Narottam Sekharia Foundation Group. They are giving the scholarship, but we have to go through all the different parts. But they are not giving only pharmacy; they are giving some other science and technology people. But pharmacy people can also get it. And one nationwide scholarship test is also there, NEST, where we can go through different type of scholarship, where the pharmacy student can also get in B.Pharm also or in M.Pharm also. And then Pradhan Mantri special scheme is there, PMSS. Those are also giving the scholarship for graduate student and postgraduate student. Those are qualified, especially like some Jammu and Kashmir students and some scholarship from colleges wise also. They are presently giving this scholarship, especially for higher education.
Thank you, sir. Your thoughtful answer to our questions have helps us gain a deeper understanding of the M.Pharm admission and other scholarship scheme and process helpful student for M.Pharm admission. Thank you, sir. नेक्स्ट क्वेश्चन मेरा आदरणीय जीडी गुप्ता सर से है। सर्वप्रथम आपका फार्मालोक संवाद के इस एपिसोड में स्वागत है सभी पैनलिस्ट का। मैं अंकुर अग्रवाल, मॉडरेटर फार्मालोक, टीम फार्मालोक की तरफ से स्वागत करते हैं, अभिनंदन करते हैं। सर, you're audible, sir?
Yes, thank you, Ankur ji, thank you very much.
धन्यवाद सर। सर, मेरा क्वेश्चन आपसे ये है सर कि भारत में कितनी एम फार्मेसी शिक्षा विशेषताएं उपलब्ध हैं, कितनी ब्रांचेस एम फार्मा में, वेरियस ब्रांचेस सर आपके यहाँ आईएसएम मोगा कॉलेज में भी इस वक्त है, और कृपया इन शाखाओं के बारे में, नई शाखाओं जैसे एम फार्मा एंड मेडिकल डिवाइसेस, एम फार्मा एंड फॉरेंसिक फार्मेसी, एम फार्मा एंड फार्माकोविजिलेंस और फार्मा मार्केटिंग में एमएस के बारे में आप विस्तार से हमारे स्टूडेंट और दर्शकों को बताएं।
So thank you very much, Mr. Ankurji. So first of all, I am thankful to the Pharma Lok for giving this opportunity to interact on this panel, and I also thankful to the whole team. Dedicatedly, you are doing the work for the profession. So I just watch on the screen Dr. Alok Mukherjee, Dr. Vijay Vallaji, and Dr. N. Sat Narayan ji, Dr. Geeta. So all the very experienced dynamic person available on the panel, and you have given some of the name of the some of the specific branch. As per my knowledge, all these branches is the not available in the Pharmacy Council of India as the approved format till date. And the Pharmacy Council of India, there is the no any definition of the M.Pharm in the pharmacovigilance. If this is the newly launched, then I don't know. But till date, this is not existing. So these are the definition. Only the private universities they are providing, but Pharmacy Council of India giving the permission M.Pharm in the 12 branches. And these 12 branches, one of them you can say 4 are the basic branches, and for all 8 branches, the sub branches you can say that. Let us consider in the pharmaceutical chemistry and their sub branch, they have the announced that this is the pharmaceutical analysis. In the same way, in the pharmaceutics, quality assurance, industrial pharmacy, regulatory affairs, and the M.Pharm in the pharmacy practice, and you can say M.Pharm in the biotechnology, pharmaceutics. So these types of the 12 branches are established by the Pharmacy Council of India. So those institute running by the private or the government institution, most probably they are only take the benefit of the government, just like Dr. Alok ji given like permission or the grant for the scholarship like that. If you want to take the opportunity with the Pharmacy Council of India, only in these branches. But some of the universities, they are doing the work in the different manner. They are using the dual degree, and in the dual degree, they are giving the different system. Let us consider M.Pharm, B.Pharm, B.Tech, B.Pharm, M.Pharm, and these are the 5 years. So even that Pharmacy Council of India, even that they are not giving any the you can say dual degree at a time, but they are providing the first degree as the B.Pharm and second degree is the post graduation. So this is the different definition nowadays. UGC given the very special and sharp definition. Okay, what is the utility and what is the application of your branch? You can submit accordingly candidate or the university pass the curriculum by the board of studies, go through the academic council and submit through the UGC, and UGC core committee they can be the include if they have the no any specific objection. But in my opinion that those institute running these types of the M.Pharm program, and I feel that it is not possible if they want to take the permission from Pharmacy Council of India. I have come to know one of the board is the given on the website or somewhere. I have just go through it. There is the written that this degree is not suitable for the registration of the pharmacist. This is the given by the itself the university. This is the oriented for the job oriented degree, but this is not the, you can say, application for the registration of the pharmacist. So those students who want to take the advantage of the pharmacist registration on the basis of the B.Pharm and they want to the continue in the M.Pharm, let us consider recently Pharmacy Council of India just given one of the circular. They have especially mentioned that the person who is want to the registered pharmacist in particular state, he or she is to require the registration in the same state. So this types of the thing is the ongoing on, and nowadays very frequency and very fast track number of the changes and number of the modification is the going on. So I am talking about that what we have the achieve and what we are the knowing till the 1 or 2 year, 1 or 2 week of the before like that. But any advancement in the recently, this is not in my knowledge. If any student want to the M.Pharm in any branch, so you can do the M.Pharm in any branch, and specialization, this is up to you. Let us consider regulatory. There is the lot of demand in the pharmaceutical education, but those who want to the work only in the academia, then they feel that I want to the basic branch like a pharmaceutics, pharmaceutical chemistry, pharmacology, and but those who want to the open to anywhere, they can also choose the you can say pharmacy practice. Analytical chemistry is the one of the excellent branch, and lot of scope is there. And even the pharmacognosy nowadays, I have received number of the phone call nearby institution and from the different state. You can provide some of the faculty member in the pharmacognosy, because number of the institute they have the closed down the pharmacognosy, so the availability of students is the very less. So this is up to the student what types of the career they want. They want the career only in the academia, or they want to the career open in the industry also. So all branches the equivalent. In my knowledge, in my opinion, nothing is the wrong and nothing is the higher. Let us consider I am the pharmaceutics person. It means not that the pharmaceutics is the very premier branch, because the person those who are the occupying the good position and did the M.Pharm in the pharmacognosy, so also the premium branches. So I think there is the no any parameter, only the parameter what do you want in your life and how you want to achieve the goal. So I hope that you have given some of the specific branch name. I did not know how you can come to know that and where they are. Peoples are the running. This is not in my knowledge, but yes, number of the private universities they are doing M.Pharm in pharmaceutical management, and some of the AICT is the also given that this is the master degree in the pharmaceutical management, but in the definition or the pharmacovigilance nowadays M.Pharm in the artificial intelligence also some of the course curriculum is the going. Obviously within 1 2 year it can become in the practice. What we nowadays and today we can say that only the 12 branches, this is you can say justify available on the Pharmacy Council of India portal. Over
ओके
to
सर,
Ankur.
थैंक जी सर, थैंक यू सर। आपने जो हमारे दर्शकों को और स्टूडेंटों को ब्रांचेस के बारे में बताया, योर नॉलेज, एक्सपीरियंस एंड क्रिटिकल एनालिसिस हैव एनरिच्ड our understanding of this important knowledge and its implication for the future of pharmacy education in our life for M.Pharm student. So thank you so much, sir. Over to Geeta ma'am.
Thank you, Ankur. So my next question
जी
is to Dr. Vijay Bhalla, sir. Sir, can you please enlighten us about the different procedures to take admission in M Pharmacy? Sir, you are not audible. Sir, please unmute yourself. I think there is some problem with the network. So my next question is to Dr. N. Satyanarayan, sir.
जी
Sir, how to select the specialization on the basis of oriented or interest oriented or scope oriented branch?
Good evening, all panel members. And first of all, thank you very much for Pharma Lok and the entire team for giving me this wonderful opportunity to share some views to the students, those who are seeking these advices. Yeah, as Dr. Gupta, Professor Gupta sir, he explained well, the students now after B.Pharm when they are looking for the branch selection, as of the first preference I will give it to the interest, the basic interest. He self told very clearly that what you want to become, whether you want to select academia or in industry, the same thing I will tell you. B.Pharm students, they have a basic knowledge in the last 4 years. They know well about the pharmacy, and I hope that they should know about the current scenario in this country also. So, in that case, what kind of interest they have basically, that is the first preference I feel. So, once they suppose a student want to do something with pharmaceutical chemistry, if he is good with the pharmaceutical chemistry or maybe is good in pharmacology, so on that basis he can go for the selection. Of course, yes, job oriented nowadays, even in the beginning during admission also people are directly asking what would be my package. Once they get admission, that moment only the students are asking about the package and placement and all. Okay, but the thing is, how you are going to shine in the field by first of all gathering your knowledge in that particular field. So in that way, you select the course first. As he told, lot of other courses are there like pharmaceutical chemistry, pharmacology, zootics and all. Yes, of course, when you are thinking about your career, some certain idea will be there for the students at the beginning. Maybe they would like to go for industry. Some students may go to only academia. Some students may willing to work in the industry, whereas some students they want to work only in documentation type of work. Okay, so what is your basic interest? You just self-analyze first, because many of the students now also we can witnessing that once they join in industry, 1 or 2 years they cannot sustain, then immediately they want to shift from there. So in that case, what type of work you want to do? Whether are you interested in the formulation development, or your basic interest is there in the research, or if you are want to work for a documentation like pharmacovigilance or maybe some other work. In that case, regarding what type of interest you can select your branch. So this is like combining your basic interest as well as combining that job oriented course. Okay, about the scope, pharmacy has got an excellent scope. So there are so many areas where our pharmacy students can take up their jobs. So like pharma industry, you all are well aware that pharma industry's development is tremendous development is there in the country, and every year there is a lot of need for the pharmacy graduates. But if you can see the number of colleges and the number of graduates, those who are coming out every year, there is a heavy competition. Again, I will tell you, as Dr. Gupta sir told very clearly, this is, see, thousands of students are coming out in a year, but few are more successful, few they found job very easily, whereas others are struggling for job. So what is the basic things behind this? While studying, the skills they should develop. What all the skills are required, the quality education, quality teaching, these all will be provided by the leading institute. So students should take up this knowledge, they should develop their knowledge. Along with the knowledge, not only the subject knowledge, but also they should have the soft skills or the other skill, the skill development. Now many colleges started with the skill development. So these things they should develop so that when they come out of the college, when they go for job, these kind of other knowledges also will be highly helpful. So again, there is no matter of selecting this any of the branch. All branches they have a very good equal opportunities. Even pharmacognosy recently, 2 3 years back, there was a say that pharmacognosy opportunities are going down. It's not like that. Whoever taken the pharmacognosy also they could find the right job that they can go in the right way. So as of me, the straight away answer for your question, selection of the specialization, as of me, it should be first their interest, then the second preference will be given to their job oriented selection. That is what my idea.
Thank you, sir. Your thoughtful answer to our question have helped us again a deeper understanding of the practical aspect of this policy and the challenges involved in and its implementation, job-oriented courses, and pharma industry lot of need pharma graduate. So many important points for your side. They helpful in pharma graduate student. Thank you, sir. My next question is Dr. Vijay Bhalla, sir. I am audible, sir. You're audible, sir. Dr. Vijay Bhalla, sir.
I think something is the technical problem related to the net
Ji,
or
sir.
something issue.
Yes, Bhalla, sir is going on. Yes, Dr. Bhalla, sir. Unmute कीजिए, sir. Dr.
Sir,
Bhalla,
please
sir.
unmute yourself.
Okay, sir. Okay, sir. My next question is Dr. Alok Mukherjee, sir. Dr. Mukherjee, sir, my question is, what are the
हाँ जी बोलिए.
prerequisite or skill? What are the prerequisite or skill required in student that are helpful for success during M.Pharm and after completion? And what are the different features or advantage of the M.Pharm program rather than another technical program या courses? जी sir.
अंकुर जी आपकी आवाज बहुत साफ नहीं आ रही है, लेकिन मैं आपके क्वेश्चन को
Yes,
समझ
sir.
पा रहा हूँ. I
जी
like
sir.
to answer this because nowadays there are different methodology of M.Pharm doing is there. Some of the
जी
institutes
sir.
are making the M.Pharm student without going through regular classes. So this is one type of M.Pharm is going through throughout the India in different institutes. I'm not naming them, but very few institutes are there like Dr. G.D. Gupta. No, ISF has good. Similarly, lot of other institutes which are regular.
Alok ji, voice is not clear. I think something is the problem.
Yes sir. सर की आवाज लगता है टेक्निकल प्रॉब्लम से कम आ रही है.
Initially, it was good with him. Now, again, problem.
Okay sir.
So, Bhalla sir.
Okay.
Good evening, sir.
Okay,
Good
sir.
Yes,
evening.
yes. Now, good evening, good evening.
Good
Now,
evening.
everything okay. So, take the question with Dr. Bhalla ji, and his
Sure,
smile
sure,
is
sure.
Yes sir.
just giving the so many
Now,
good things,
I am
positive
excited to
signs.
answer, but I am sorry today because of some technical problem.
Now, all is well,
Okay,
now
sir.
it is
sir.
clear. Yes.
Thank you, sir. Okay, sir. Dr. Bhalla, sir, is going on. Thank you, sir.
Yeah.
My question, Dr. Bhalla, sir, what is the
Ji, ji.
procedure of to take? What is the procedure to take admission in post graduation in pharmacy in India? What GPAT qualified or
Yes.
without GPAT qualified? Ji, sir.
Sure, sure, sure. Very interesting question. I won't waste time. I'll immediately come to the.
Okay, sir.
In fact, let's understand the regulations. As far as regulations are concerned, pharmacy is one such program which was earlier controlled by All India Council of Technical Education, AICT, and later the recognition, as Dr. G.D. Gupta told, that 12 specializations were given the permission by Pharmacy Council of India. We look at the pharmacy profession. Basically, we work in three major domains. One is chemistry, other is manufacturing, and third is a control, CMC. It is not carboxymethyl cellulose, it is just chemistry, manufacturing, and controls. So wherever chemistry is there, chemical science deals a lot of play a lot of importance. We believe in biological science also. There are so many programs related to biology also, and their third is a pharmaceutical sciences. So many programs are there, all are related to this. As far as admissions are concerned, AICT has announced the graduate pharmacy aptitude test, GPAT entrance examination. And by virtue of that, people have to qualify the entrance exam, a gate exam taken by a GPAT board. Earlier, it was used to conducted by All India Council of Technical Education. So the students who qualifies GPAT, they are given scholarship by the AICTE for the 24 months continuously. There are many state private universities and central universities or even other private universities also. They give admission to master's programs even without GPAT also, where they do not get any type of scholarship. Then we do have a NIPER Act also operational in our country. So we have NIPER, National Institute of Pharmaceutical Education and Research, under the Ministry of Chemical and Fertilizer, who is giving a lot of funding to these institutions. So as per NIPER Act, they have their own joint entrance examination for all the NIPER centers. So in all these centers, so NIPER has to be qualified, and then NIPER also gives them a scholarship. Very recently, I was discussing with one of the key member of Pharmacy Council of India. After the denial of All India Council of Technical Education for not giving scholarship to the pharmacy program, so now Pharmacy Council of India, as far as they've agreed in their executive council meeting, not in the CEC, Central Council, it has yet to be approved. But PCI has taken the responsibility to give the GPET scholarship to the students who qualify, and even PCI only, but through NTA will be conducting the test also from next year 2024 onwards. But 2023, of course, HRD Ministry and GPET will be given. So as far as for a Bachelor of Pharmacy graduate, whosoever qualifies bachelor's degree with more than 55% in some of the institutions, but some of the institutions, they take 60% and above only for admission. So they have n number of programs. There was one of a very interesting equivalence circular by Pharmacy Council of India in 2000, because the M.Pharm regulation passed in the year 2014 in our country by Pharmacy Council of India, and everyone had to adopt, because usse pehle there was many universities, they were not having Bachelor of Pharmacy program, but they were running a Masters of program only. So to curtail that, Pharmacy Council of India announced the regulation in 2014 for Masters of Pharmacy, and in 2017 they announced equivalence programs also. Equivalence program basically in item number 213 in 102nd Central Council meeting held on September 2017, and item number 89 in the Executive Council 281 in November 2017, where some of the equivalence program were given the masters of degree who can teach other bachelors also. So in those equivalence degree, we can say we can have a clinical pharmacy, we can have a hospital pharmacy type of master's program, whosoever has done before 2014. So similarly, natural products also, and phytomedicine. So there were some equivalence programs given by Pharmacy Council of India. So if a person wants to now teach a bachelor pharmacy practice basically, so they can, even a masters of hospital pharmacy earlier, else erstwhile, is equal, they can teach that also. Even recent addition is doctor of pharmacy, PharmD program qualified students also can teach B.Pharm practice or masters of subjects of pharmacy practices in bachelor's degree. So for admission, I would say NIPER Act and AICT with regulation of Pharmacy Council of India, they are there if they want to have a scholarship. Otherwise, most of the universities, they take admissions with students passing with 55% of bachelor's degree. Thank you very much. I hope I justified the answer.
थैंक यू सो मच सर. आपने बहुत ही स्टीक शब्दों में सब प्रोसीजर हम लोगों को बताए, और it will going to help us our students definitely. Thank you so much, sir. So my next question is to
You're
Dr.
welcome.
G.D. Gupta, sir. Sir, can you please enlighten us
Yes,
about
yes,
the
yes, yes.
academy industry collaboration programs for M.Pharmacy students and their current status in India?
So thank you, Dr. Geeta ji. Very excellent question. And I did my M.Pharm in 1995. At that time, I have also attended two, three conferences: industry academia collaboration, industry academia partnership. After that, AICT launches, this is known as the IIP, Institutional Industry Partnership Cell. So all these things are most probably, if you want to the listen to me in the true form, at that time only a few institute they are working in this direction. Otherwise, even from 1995 to till date, no any development in a sharp level. The problem of the sharp level, because no any definition and mandatory clause in the pharmacy curriculum, each student or some of the industry required to give the industrial training to the student. They are not, there is no any mandate if you can take the admission and not. Second thing, in the seventh semester, if the student want to take the training for the three for 1 month or 2 months, but industry peoples have, there is the no time, because they have no any such types of the mandate. So 90% of the student they are only have the certificate, what they are no involvement. Yes, nowadays industry is searching the good peoples. What, where is the good people? This is the again very very important. Industry searching the one of the good institute, but where is the good institute? So only the few institute they are working on this direction. But now this is the right time, as we are the growing very fast. We need a lot of space in the industry also. So for this purpose, strong collaboration is the required, not only the in the form of the MOU, not in only in the form of the just like a invitation in a conference of the two three peoples of the pharmacy, you can say industry peoples. These things are not sufficient. One of the person I call on the platform of the discussion from the industry, like a vice president rank person, he just told, डॉक्टर गुप्ता, एजुकेशन वाले सब कुछ इंडस्ट्री से फ्री क्यों चाहते हैं? वाई यू वांट एवरीथिंग फ्री, गिफ्ट सैंपल फ्री, ट्रेनिंग फ्री, एवरीथिंग फ्री? क्या हम लोग बिल्कुल बेकार बैठे हुए हैं यहाँ पर? वी हैव द नो टाइम. So I request to the peoples, those who are connect with the industry, if in the true manner we want to work with the industry for this purpose, we need to some of the specified collaboration and some of the guidelines mandate to the industry to give the training at least 25 students. Otherwise your lessons will be the cancelled, or 100 student in a year. Otherwise it is not possible. Second thing, as you know that industry they have given one of the rules and regulation in the Pharmacy Council of India, that every pharmacist retail, those who have the license, they are required to attend at least one meeting. So some of these states they are the doing 100% good work, बट दिस इज नॉट कॉमन. मैं यहाँ पर इस चैनल से कहना चाहता हूँ, हम एक राष्ट्र एक नियम की बात करते हैं, क्या ये फार्मेसी पर लागू नहीं होती है? अगर होती है तो क्यों नहीं हो रही है? इफ द एनी टाइप्स ऑफ द प्रोसेस, आइदर द रजिस्ट्रेशन, either the starting of the retail, wholesale, industry, rules must be the same in the throughout the country. मेरी वॉइस जहाँ तक जा सकती हो, इस पर होमवर्क करना चाहिए. स्टेट टू स्टेट वेरिएशन, लॉट ऑफ कंफ्यूजन, समझ से कई बार बाहर होता है. Somewhere is that you can get the D farm, and after 3 years you can register for the pharmacist license. Somewhere you can get the D farm, immediately you are the registered pharmacist. and you can open the shop. So these types of the rules and regulation, and after the B.Pharm, you can do the work in the 1 year. After that, you can register pharmacist initially, but you cannot do the open the shop. So this types of the things is the required to be the justify, because somewhere it will create the problem, and state to state variation definitely create the problem. So I hope that in coming days some of the issue they will be resolved, and our professional body, I think they are also doing the work on different things. लेकिन मैं अवश्य कहना चाहता हूं कि एक बॉडी, एक व्यक्ति, एक सिस्टम किसी भी चीज को ठीक नहीं कर सकता है। अगर किसी को ठीक करना है तो हर व्यक्ति अपने गलेवान में झांक करके देखे कि जिस सिस्टम में वो काम कर रहा है उस सिस्टम में कितना ट्रू मैनर में काम हो रहा है। मैं समझता हूं खुद ब खुद ट्रेन अपने आप चल पड़ेगी, इंजन और जो है ड्राइवर की जरूरत नहीं है। लेकिन आज बहुत सी चीजें हम धक्के से चलाना चाहते हैं। तो पैनल कितना झूठ बोले, मैं तो ये कहता हूँ इस पैनल पर बैठ के मैं कितना झूठ बोलूं और क्यों बोलूं, मेरा अपना मन है। तो सत्य यही है कि अगर हम ज्ञान बांट सकते हैं और कुछ कह रहे हैं, क्या मैं उस पर 80% चल रहा हूं? अगर चल रहा हूं तो अवश्य कहूं, और अगर मैं नहीं चल पा रहा हूं तो मुझे तो खेद होता है, बकाया मुझे नहीं पता। आज हर फार्मासिस्ट, हर इंडिविजुअल की आवश्यकता है। कौन से, जैसे अभी कई पैनल पर या बातचीत होती है, कौन से रूल्स में लिखा है आप जो जैसी बातचीत कहते हैं कि नॉन अटेंडिंग, नथिंग दैट्स ऑल। एक व्यक्ति ने मुझसे पूछ लिया था, मैंने कहा यू आर द रॉन्ग पर्सन, डेफिनेशन इज द रॉन्ग, और जो लोग ऐसा कर रहे हैं यू कैन गिव दी कंप्लेंट, उसको करिए, ठीक है, या अपने आप चीजें शट डाउन होंगी। आज अगर फार्मेसी प्रोफेशन को बचाना है और ग्रो करना है तो सिर्फ इस डेफिनेशन से बाहर आना पड़ेगा कि एडमिशन 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 एडमिशन। हमें ये चाहिए कि वेयर इज द प्लेसमेंट। आज एक इंस्टीट्यूट टारगेट करे, आज एक डायरेक्टर टारगेट करे, आई एम अ वेरी नाइस एंड एक्सीलेंट डायरेक्टर बिकॉज 100% एडमिशन एट व्हाट कॉस्ट। ये होमवर्क करना बहुत जरूरी है, तभी हम मैं इंडस्ट्री के लोगों से बातचीत करता हूं तो वो कहते हैं कि आपके बच्चे को क्या आता है, मैं बताता हूं ये आता है, तो उनको बिलीव नहीं होता है कई बार। तो जो अच्छे इंस्टीट्यूट हैं जो एक्चुअल फॉर्मेट में ट्रेनिंग दे रहे हैं, सबसे ज्यादा मात, और हमारे V.Pharm M.Pharm बच्चों के लिए व्हाट इज द प्लेसमेंट वैल्यू, आप बताइए मुझे। दाल रोटी नहीं खा सकते हैं वो, दिस इज द प्लेसमेंट वैल्यू। 8,000, 10,000, 15,000, 20,000, 25,000 रुपए, अगर 30,000 रुपए भी पर मंथ किसी को मिल जाता है, क्या वो मुंबई जैसे शहर, दिल्ली जैसे शहर, बेंगलोर जैसे शहर में सरवाइव कर सकता है? इस पर हमें होमवर्क करना पड़ेगा, और कुछ ना कुछ गाइडलाइंस अगर हमें कुछ निकालनी है तो इस पर भी गाइडलाइंस निकाली जाएं कि आइदर द एकेडमिया, आइदर द इंडस्ट्री पीपल, starting position is this one, length of the job in the first you can period for this 6 months is this one, so that confusion it will be reduced. Where in the industry peoples are the industry, the also pharmacy peoples, they also did the B.Pharm, M.Pharm and PhD, what they have the 20-year experience and 25 experience, and their salary package in the even in the crore, what they are giving the offer is the very less. तो इस पर होमवर्क 100% करने का बहुत जरूरी है। उस दिन इंडस्ट्री चेतन हो जाएगी, हम चेतन हो जाएंगे, पूरा सिस्टम चेतन हो जाएगा, और हमारा बच्चा बहुत ही ब्राइट फॉर्मेट में काम करेगा। आई एम थैंकफुल टू कोविड गाइडलाइंस एंड टाइम ऑफ द कोविड, दैट्स द फार्मेसी profession that come out and it will grow. Lot of people, government and number of the professional body, they can be attracted about the pharmacy profession. So this is the right time, we can grow in the right direction with the right value and right potential. Then I hope that this will be the benefits. Thank you very much.
Thank you, sir. Thank you, sir, for regarding provide information academia and industry collaboration program and their current status in India. आपने अपनी बात को जो बेबाकी से हरदम की तरह रखा है, उसके लिए सारे दर्शक और पूरा फार्मा फील्ड आपका हृदय से शुक्रिया करता है सर। और निश्चित तौर पर सर हम अपने बच्चों को अगर इंडस्ट्री ओरिएंटेड बना सकेंगे तो आपकी बात भी दूर तक जाएगी और हमारा बच्चा भी बहुत कुछ सीखकर इंडस्ट्री में एक अच्छे पैकेज पर काम कर सकेगा और अपनी उन्नति कर सकेगा. थैंक यू सर. माय नेक्स्ट क्वेश्चन इज डॉक्टर सत्यनारायण सर. माय क्वेश्चन इज, हेलो सर,
Yeah, please go ahead.
ऑडिबल सर?
Yeah,
Okay, sir.
audible. Yeah, please go ahead.
M.Pharm, yes sir. M.Pharmacy is basically a research oriented program and final year is totally research based for student. So how student can utilize final year research in their future life?
Final year D.Pharm you mean to say? M.Pharm you want to say?
M.Pharm sir.
Okay, yeah.
Yes sir.
See, M.Pharmacy.
M.Pharm research project sir. Ji sir.
Correct. M.Pharmacy, it is research oriented, correct. So the second year they are expected to
Yes.
submit their thesis on purely on the research basis.
Yeah.
So here the course, the total
Okay.
objective, the thing is to create the research culture for the students, so the students will be highly motivated to involve in the research activity. In fact, in the first year itself, most of the students in most of the good colleges, they are provided with the research environment, because nowadays you all aware that research and development has got a very important aspect, because the government is also concentrating more to develop the research and development in the country, especially for pharmacy course, healthcare related things. Our students are involving in very good projects. Though maybe when you compare it to some other courses, these kind of healthcare projects in pharmacy is getting developed in a very good way. I can say the way how the leading colleges are giving the projects is really helpful to develop their research knowledge. So now coming to connecting these students' research knowledge, what they are getting during their M.Pharm to their real life when they go. There are many pharma industries where the research and development unit need people and the right people. So you cannot say within a year the person can develop in his research activities completely and he will come up. No, but it is a good initiation that the research mind will be ignited to our students, so that what kind of research area they get exposure, the same thing they can able to develop. But most of the cases it's not happening, because what kind of research work they do, it is purely totally depending on the research facilities, or it is available in their parents institute, or else it's depending on the mindset of the research guide who is giving this research project for the students. However, the same related area is may not be available for them when they take their career. But how this will be highly helpful, because the student is already ignited how to make a research. Example, the research methodology, a subject is there which will tell you the basic ideas about the research, any kind of research, how the student can able to develop, do some research literature survey, how to identify the research problem first. Just following the previous paper, whatever the international journals are there, just by seeing the international papers and just changing the drug name and doing some activity and doing some kind of research work, that is not the thing of research. Students will be given an exposure what is research and why the research work has to be done. 1 year he is spending to do some research activities in any of the branches. Why the work should be done, that basic things would be developed, so that the student, when he go to the industry, there he can take up that whatever the work is given to him, he can able to take up that work. So the basic knowledge which is developed in the research activities during this M.Pharm is highly helpful for them when they go to select their career. Of course, suppose if the student is not involved in the R&D, if he is not taking up research, maybe in the PhD and other things, if you are not doing, if you go to the some other area like a job like production, or maybe some other job where the research is not a part. However, this knowledge is going to helpful in his career, because the literature survey, how to select, how to do the literature survey, these all things are going to be a part in his career. So definitely this kind of research training is going to help the students in their career in a very manner. Yeah.
Thank you so much, sir, for your provoking views. Thank you so much. So next question is to Dr. Alok Mukherjee, sir.
Yeah.
Sir, what are
Yeah,
the
Dr. Geeta.
different? Yes, sir. Sir, what are the different prerequisites or skills required in undergraduate students, which can help them for their M.Pharm?
What are the?
Different
Can you repeat the
prerequisites.
question?
Sir, what are the
Oh, okay.
different prerequisites or skills required in
Okay.
undergraduate students, which can help in their M pharmacy?
While definitely. First and benefit, first important requirement is required that while doing this B form, they should develop the interest in which field they want to go. At least in case of when they are in the third year or in fourth year, they should develop their interest in what type of field they can join. Either they should go for the academia, they should go for the R&D, or they can go for F&D, or in case of industry for manufacturing, quality control, or quality assurance. But while doing this third year and fourth year, they have also some topics like elective subjects are there. While doing this elective subject, they should have a mini project also there. Uh, and this selecting this mini project in B Form fourth year, they can also decide their career into field of different science, like they can go for artificial intelligence, they can go for some pharmaceutical industrial pharmaceutical chemistry, pharmaceutics in cosmetical science. So there are different fields are there, and while doing this prerequisite in this part of their in the fourth year, they can decide which field of the M form they can decide. Either they can go for some industrial synthetic chemistry, they can go for manufacturing pharmaceutics, or they can go for a pharmaceutical pharmacology or pharmaceutical analysis also. So that very important requirement while third year and fourth year, their mentors or their especially the teachers, they can at least find out what type of important interest of the students are there, and what type of facility the institute can provide them to grow their interest in a particular field. Like in case of pharmacology, when we are going for M.Pharm and pharmacology, some of the students does not know how to hold the animals especially. So during the third year and fourth year, at least they can learn how to go for a animal experiment. While although the CPCSC does not give them the experimental part of this animal experiment, but if the institute having a CPCSC approved college and having an animal you can say the store or animal experimental area for a masters. So in third year and fourth year, whenever they go for a pharmacology, they can learn how to hold the animals, how to work with the animals. So this type of prerequisite is required. In case of pharmaceutics also, they can go for some elective subject in cosmetic science, some pharmaceutical doses form, or some elective subject like in case of where they work for some cosmetologies or some marketing, especially also pharmaceutical marketing subjects are also there in fourth year. So the completely decision on the basis of their institute guides or institute teachers, as well as the interest of the students also. So they can go for they can choose their field in the form also. I think it is very important for every institute or every student also to go for a master degree before taking this some interest in the B Form final year and final year.
Okay, thank you, sir, for your words. The skill required in student that are help for success during the M.Pharm course. आपने बताया कि कैसे थर्ड ईयर और फोर्थ ईयर में स्किल्स डेवलप टीचर्स उनकी कर देंगे, जैसे कि एनिमल एक्सपेरिमेंट को लेके, कॉस्मेटिक साइंस इलेक्टिव सब्जेक्ट को लेके, तो वो एम फार्म में और उनको बहुत मदद करेंगे. थैंक यू सर. माय नेक्स्ट क्वेश्चन इज डॉक्टर भल्ला सर.
जी
सर, माय क्वेश्चन, ड्यूरिंग एम फॉर्म, what types of skill and training internships can help their student to make their future brighter?
Yeah, definitely one of the $1 million question, I understand, because
Thank you, sir.
it is not the knowledge which carries them into any of the career or industry. It is the competencies and skills which really take them to the higher level. So my first suggestions to all our students, not to do practicals in your lab, do projects what industry wants. So doing a project and doing a practical is a very big question. If you do a practical, you forget there and then only. if you do a project like start with aspirin only. So if you have understood the synthesis of aspirin, then you have understood its action on animals also. Then you have understood its bioactive activity, biological activity. Then making a formulation of it. So you're doing one complete project starting from an API synthesis to its analyticals to its characterization. So everything, then it becomes a project. Then later when you go to pharmaceutical technology, you develop different doses forms also. And later, even if you go to a marketing towards side, then you understands lot of drug regulatory affairs also, in which country you want to really export these type of. So my suggestion here is to the students not to take any practicals, take them as a projects. And for doing any projects, I am very sure they need lot of competencies and skill building. And those skill buildings can really help to find out a right kind of mentors, right kind of advisors, and mentors are going to help them. Mentors can be there in the industries also. Like if a person can really, like, I understand institutions are not able to give a sufficient exposure with regard to a lot of high-end equipments and instrumentation. Like you may not be having a LCMS in your universities or institutions, but you have UV spectroscopy and HPLC type of instrumentation. But for NMR and LCMS or GC, you need to collaborate with some industry or you have to identify some mentors. So my suggestions to students here to build up the competencies and skill and competencies are built not in a one night or one day. It builds gradually by experiential learning, by doing projects, by doing a kind of training, doing internship for 15 days at a different location. If you are weak in particularly analytics, I would appreciate you go to a commercial testing lab or any other government approved lab and understand the functioning principles, working and operations of all these analytical instrumentation. If you are really weak in API synthesis, if I'm medicinal chemist, why still MScs are going to in API synthesis industries? Because the government, this industry doesn't trust that a pharmacist is a good medicinal chemist, and MSc people are better medicinal chemists, because the reason is they have not worked in the intermediates, they have not worked on the impurity profiling, they have not worked on the NCEs, they have only studied these things. They have done a lot of studies in NCEs, new chemical entities. They have studied intermediates. They have studied kilo labs. They have studied basically impurities and impurity profiling, but they have not worked on any of the hoods in the chemistry. So I appreciate if the student takes all these type of exposures in a short term or long term in an industry, take a project in the industry, have a complete knowledge of the subject. I'm very sure if they develop those competencies, even asking money to the industry will also not a problem. If company is hiring you on some of the skills, they can give you any amount of money. But if company is hiring only on your knowledge, not on the skills, then they have to train you first and then they have to offer you some money. So they will give you a small amount of money only. That would be a sort of investment of yours to the company to learn those techniques. I think that competency building is very important phenomena for any of the student. Thank you.
Thank you, sir. Thank you for lovely words and your advice for types of skills and very interesting topic you define training program, internships, and can help the student to make their career and future. And especially we learn CMC and your last advice, chemistry manufacturing control. So thank you very much,
Yeah.
Dr. Bhalla sir. And my next question is Professor GD Gupta sir. Hello sir. Yes. Audible sir.
Yes, yes, please.
Sir, my last question is sir. Sir, please share your take home message for students.
So, thank you very much, Dr. Ankur ji. First, you have already mentioned this is
Thank
the
you.
last question because you are asking very difficult question, and it is very difficult to give the information at a national level because nowadays this is the electronic media also creating lot of confusion and misconception like that. So, thank you very much, and take home message only this one. If any person who want to opt this profession तो मुझसे ज़्यादा वो उसको कुछ भी सोचने की ज़रूरत नहीं है. I have taken the admission in 1989. उस वक्त मुझे ये नहीं पता था कि व्हाट इज फार्मेसी. मुझे उस वक्त ये नहीं पता था मैं फार्मेसी क्यों कर रहा हूँ. मुझे इस वक्त ये पता नहीं था कि मेरा एडमिशन हो गया अब आगे क्या होगा. लेकिन when I have taken the admission and completed the B.Pharm, उस दिन मुझे ये अवश्य पता था कि अब मैं फार्मेसी का व्यक्ति बन के ही रहूंगा. तो टेक होम मैसेज इज दिस वन. व्हाट आर यू डूइंग? What types of you are doing either in the any branch, even you are the diploma or the B.Pharm, because I know number of the person those who have no any big degree, no any gold medal, what they are at the top most position. तो सिर्फ इतना है कि आप अपने जीवन में एक लक्ष्य अगर आपने सोच लिया कि नाउ आई एम पर्सन ऑफ द फार्मेसी और बकाया चीजें व्हाट यू हैव डूइंग इन द यू कैन पास फॉरगेट इट कि मैंने क्या किया था, क्यों किया था, कैसे किया था. एक व्यक्ति ने एक बार एक कहा कि इसका सिलेक्शन इसलिए हो गया क्योंकि इसकी जुगाड़ थी. तो मेरे सिंपल शब्द थे, तुम्हारी नहीं थी फॉरगेट इट. उसकी थी, उसने लगाई जुगाड़. आपकी नहीं थी तो आप क्यों चिंता कर रहे हो. इसलिए सिंपल सा कंसेप्ट है. एनी पर्सन हु वांट टू सक्सेस इन देयर लाइफ he accept what he achieved and in which degree he or she is the doing the work और उसमें कितनी स्किल हो सकती है, कितना उसमें आपका डेवलपमेंट हो सकता है, सिर्फ इस पर फोकस कर दिया जाए. आई होप दैट नथिंग बिहाइंड टू यू, everything you can achieve in your life, but number of time I feel that up to the final year we are unable to understand that why we are doing the pharmacy, because I know that number of the institution, number of the problem, one professional body running whole of the system. So obviously if the one professional body, one rules and regulation, what differentiation maybe take place, forget it. I know that number of the student who did the B.Pharm, very simple institute, and now they are even in the top position. So what? Let us consider you did the B.Pharm in the private institution or the government institution. छोड़ दीजिए, गवर्नमेंट किसी को भगवान नहीं बनाती है और प्राइवेट किसी को खराब नहीं करती है. इसको सिंपल यस, इफ यू आर डूइंग द वर्क इन द गवर्नमेंट, आइदर गवर्नमेंट और प्राइवेट, अगर एक श्रेष्ठ काम करते हैं आप तो उसको कोई चूक नहीं हो सकती है. मेरे पास सैकड़ों ऐसे एग्जाम्पल हैं और कई वर्षों जो फार्मेसी काउंसिल ऑफ इंडिया के प्रेसिडेंट रहे हैं वो प्राइवेट इंस्टीट्यूट से ही है. कई वर्षों एपीटीआई के प्रेसिडेंट रहे हैं वो प्राइवेट इंस्टीट्यूट से ही है. इसलिए ये चीज दिमाग से व्यक्ति को उतार देनी चाहिए कि वेयर आर यू. आप सिटी में कर रहे हैं, गांव में कर रहे हैं, विलेज है, डिस्ट्रिक्ट है, व्हाट लेवल, आप जिस लेवल पर कर रहे हैं. इसलिए कहा जाता है कोई जरूरत नहीं है कि हेलोजन की लाइट में पढ़ करके ही आईएएस बने. आईएएस बनने की अगर कुव्वत रखते हो तो एक कैंडल भी सफिशिएंट है. सो आई होप दैट अपने दिल में जुनून जगाएं. कल 15 अगस्त है एंड इंडिपेंडेंस डे है, स्वतंत्रता का दिवस है. तो आप अपने दिल में एक ऐसी चिंगारी जगाएं जो कम से कम दूर तक जाए. और इन्होंने लास्ट क्वेश्चन कहा है तो मैं 2 पंक्ति से अपनी बात को खत्म करता हूं. माना कि चारों तरफ अंधेरा है, कम से कम एक दीपक तो जलाइए. दूसरों की ना सही, अपने अपने जीवन में थोड़ी रोशनी तो लाइए, थोड़ी रोशनी तो लाइए, सब जगह लाइट हो जाएगी. सो थैंक यू वेरी मच मिस्टर अंकुर जी.
थैंक यू सर. थैंक यू सर. for lovely words and energetic words for our students, our professionals. आपकी जो बात है बहुत दूर तक जाएगी सर, पूरे जोश के साथ सभी लोग फार्मेसी करेंगे और आप हमेशा ऐसे ही मार्गदर्शन करते रहिए सर. मैं नेक्स्ट कमेंट्स फॉर डॉक्टर भल्ला सर और फ्यू मैसेज फॉर स्टूडेंट्स एंड व्यूअर्स. डॉक्टर भल्ला सर.
हाँ यस
Okay.
सर, मैं 2 मैसेज दूंगा
जी
अपने
सर.
स्टूडेंट्स
Yes.
को. एक तो सबसे
जी.
पहला कि हमारे स्टूडेंट्स कोर फार्मेसी से भागते जा रहे हैं. कोर फार्मेसी से भाग के दे आर गोइंग टू द ग्लैमरस आईटी इंडस्ट्रीज फॉर फार्माकोविजिलेंस, क्लिनिकल ट्रायल, प्रोजेक्ट बेस्ड. कोई मैन्युफैक्चरिंग, क्वालिटी कंट्रोल और उसमें नहीं जाना चाहता, तो वो भूल गए हैं कि कोर जो है फार्मेसी का आज भी एपीआई सिंथेसिस, मैन्युफैक्चरिंग एंड कंट्रोल है. वहां पर जाके अगर वो कैरियर बिल्ड करेंगे, शुरू के 2-4 साल उन्हें डिफिकल्टी आ सकती है जब तक उनकी कॉम्पिटेंसीज बिल्ड होती हैं, लेकिन वंस दे आर थ्रू दे विल रियली गोइंग टू शाइन लाइक एनीथिंग. और दूसरा जो मेरा मैसेज है स्टूडेंट्स के लिए, अभी मेरे को नेशनल मेडिकल कमीशन के एक बहुत सीनियर चेयरपर्सन का एक फोन आया कि हम बार बार बात करते हैं फार्मासिस्ट इज नॉट गेटिंग अ ड्यू रिकॉग्निशन, फार्मासिस्ट की पहचान नहीं है. सो ही जस्ट आस्क्ड मी हाउ द इंटरवेंशन ऑफ अ फार्मासिस्ट हैज इंप्रूव्ड द क्वालिटी ऑफ लाइफ ऑफ अ पेशेंट. हाउ द इंटरवेंशन ऑफ अ फार्मासिस्ट हैज इंप्रूव्ड द लाइफ ऑफ अ पेशेंट. तो हमें इस सवाल का जवाब देना है कि हाउ आवर इंटरवेंशन हैज इंप्रूव्ड द लाइफ ऑफ अ क्वालिटी ऑफ लाइफ ऑफ अ पेशेंट. तो क्वालिटी ऑफ लाइफ पेशेंट की इंप्रूव करने के लिए इफ वी आर वर्किंग इन दैट डायरेक्शन, हमारा क्लिनिकल एक्सपोजर अगर अच्छा हो जाएगा, पेशेंट के साथ काउंसलिंग, एडहेरेंस, जो हमें फार्मेसी प्रैक्टिस रेगुलेशन 2015 में बहुत सारी अपॉर्चुनिटी और रिस्पॉन्सिबिलिटीज दी हैं, ऑल दोज रिस्पॉन्सिबिलिटी इफ वी डू इट एंड वी राइट देम, उसका पब्लिकेशन करें. वी आर नॉट डूइंग लॉट ऑफ पब्लिकेशन इन दिस रिगार्ड, क्लिनिकल फार्मेसी में, कम्युनिटी फार्मेसी में, हॉस्पिटल फार्मेसी में. इफ वी विल जनरेट डाटा how our intervention has improved the quality of a life of a patient, I am very sure gradually our recognition will be very high. We will be at par with the doctors in this country. So these 2 suggestions are very important for students. Thank you.
Thank you. Thank you, Professor Vijay Bhalla, sir. Nice words for students and professionals. My next Professor Alok Mukherjee, sir. Please give me one message for students in Pharma Lok.
मैं सभी के विषय से और इनके डॉक्टर भल्ला और डॉक्टर गुप्ता के संबोधन से बहुत ही सही सहमत हूँ कि हमारे सारे स्टूडेंट को ये सब समझना चाहिए कि 4 साल उनको जो कोर्स मिला वो प्रोफेशनल सर्विस के लिए मिला है, स्पेशली कम्युनिटी सर्विस के लिए मिला है. हमको सीखना है और जुड़ना है, कम्युनिकेट होना है फॉर द कम्युनिटी, फॉर द पेशेंट, जैसे सर ने बोला. और हमको यही सीखने के लिए रेगुलर क्लासेस और रेगुलर प्रैक्टिस करना है, प्रैक्टिकल और प्रोजेक्ट बेस्ड क्लासेस करनी है. और यही सबसे इंपॉर्टेंट है कि 4 साल में आप करेंगे तो आपके लिए मास्टर्स और रिसर्च और R&D और QC और मैन्युफैक्चरिंग में बहुत अच्छी जॉब मिलेगी. तो आप जरूर 4 साल काम करिए और सीखिए कि आपकी बेसिक रिक्वायरमेंट क्या है, because you are entering in the quality profession for the quality product also, because you are serving for the society, serving for the patient, for patient life, and that is very important. Nobody can get the chance for this type of service. तो आपको पढ़ते पढ़ते अपनी सर्विस के लिए करना है और अपने नेशन के लिए भी करना है. आपको ऐसे लोगों के लिए करना है काम जो बीमार है, और इस कारण से सबसे पहले अपनी पढ़ाई पर और अपने प्रैक्टिकल और प्रोजेक्ट पे काम करें. और ये बहुत जरूरी है, रेगुलर क्लास अटेंड करें, क्योंकि किसी ने कहा है कि एक दिए को जलाने के लिए दूसरे दिए को भी जलना होता है. और यही हम आज सभी लोगों को करना है कि हम टीचर उस बच्चे में ऐसी दिया जलाते रहें, वो जलाते रहें कि वो जलता रहे और आगे बढ़ते हुए आगे अनेक दियों को जलाता रहे. धन्यवाद.
Thank you, sir. Thank you, Professor Alok Mukherjee, sir, for nice word for student. And last comments for Dr. L. Satyanarayan, sir, for message for students.
Yeah. So first of all, for message for the
Yes.
students first. Now I'll tell you, my the students of pharmacy, you have selected the best profession already. That you believe first. You are in a best, very best profession, because the pharmacist is a person who is going to play with the life of a patient. So how much importance you are? Just you think about that. Okay, so second thing related to skill, Professor Bella sir rightly he told not only the subject. In fact, all the panel members told very clearly, not only your subject knowledge, but the extra skills, whatever skills which are required to be excelled in the field, that you need to develop. Only with the scorecard of 99.9%, if you come out without any other skills, nobody is going to encourage you in the career. So it is very much important you develop all your skills along with your subject skills. Then you can believe yourself, have 100% self confidence on you. Because I used to tell to my students usually, you can able to do whatever you want. Many of the students, the problem start with what is their goal. The goal is not fixed at all. If your goal is fixed, then the roadmap to achieve the goal can be easily done. I used to tell, even if you want to become a prime minister of India, you think you will achieve it because you have a certain goal, then automatically you will think about that. I would quote the same thing like our former president excellency Sri Abdul Kalam sir, he used to tell dream. Okay, so I used to wonder what is the use of the dream. If I have a goal which I cannot achieve, it's a very big goal. But if I dream about the goal, what is going to happen? But practically, I can realize that if you really dream, the dream only make you. It will drive you to achieve that goal one day. Because slowly, you will start some small steps towards the goal, and one day you will definitely reach your goal. So, dear students, you are in the best profession, I am repeating, and you take the example of the people, those who got an excellent position, those who got success. Again, there is a definition for success is depending on each individual. If you are satisfied with what position you are,
जी
that
सर.
if it is a success, that is your thing. Similarly, if you think about something bigger than that, you make a goal and do work accordingly, definitely you will achieve that. That is what. And for Pharma Lok, the message is you are doing an excellent job. I'm keep on watching many interviews like all senior professors. Today I got a wonderful opportunity to meet the senior professors, though I have not met them in person, but I know them by profession. But today I shared with the panel with them. Thank you so much for all of you for wonderful advices, wonderful words to students. So I think Pharma Lok, you are doing wonderful job. Please keep continue, because as other panel members told, the pharmacy field in India should be recognized much more better than this present situation. All of us, all pharmacy teachers as well as all the pharmacy profession people, we should work together to improve this. Because if you see the Western countries, the recognition for the pharmacy, especially in hospital pharmacists, that kind of recognition in India is still it is not there because of the entry of the PharmD and the NABH accreditation. Even I wanted to tell along with the M.Pharm, you would have added PharmD also. So PharmD students are coming up, and all the pharmacists, I mean hospital pharmacists, are totally now slowly started changing. So the recognition for pharmacists is definitely is going to come up in India, for which we all should work together. One of the organization, Pharma Lok, you please keep continue this thing, and all the best for your wonderful efforts. Thank you so much for all the panel members and Pharma Lok for giving me wonderful opportunities. Thank you so much.
Thank you, sir. Thank you for lovely words for students and lovely comments for Pharma Lok team. Thank you, sir. I said some lines, sir. I asked a wise man, tell me, sir, in which field could I make a great career? So he said with a smile, be a good human being. There is a lot of opportunity in this area and very little competition. So hopeful. I like to
Very
thanks
good.
for our panelist. Thank you, sir. I would like to extend a heartfelt vote of thanks to all our panelists. Dr. Vijay Bella sir, Professor Alok Mukherjee sir, Dr. L. Satyanarayan sir, and Dr. G.D. Gupta sir, and my moderator, Dr. Geeta Deswal.
Thank you, Pharma Lok.
So
Thank you.
on the behalf of everyone here at Pharma Lok and SAMVAD, I would like to express our sincere appreciation for your participation and contribution to this event. Your insights has been invaluable, and we hope that your expertise and wisdom will continue to inspire and guide us in the future. Once again, thank you so much, sir. And all student and professional, subscribe Pharma Lok YouTube channel, and आपको ऐसे ही अच्छे से अच्छे संवाद और अच्छे से अच्छे इंटरव्यू आपको फार्मा लोक देता रहेगा, और फार्मेसी के लिए हम ऐसी बेहतरी के लिए काम करते रहेंगे. जय फार्मेसी, जय फार्मा लोक. थैंक यू.
Thank you,
so
team
much, sir.
Pharma Lok.
Thank you all.
team Pharma Lok.
थैंक यू सर. थैंक यू सर.
Thank you, Pharma Lok. Thank you, Geeta Madam and Dr. Ankur.
Thank you, sir.
Thank you.
Yeah, thank you, Ankur.
Thank you, sir.
So nice, sir.